And with that government shutdown having no end in sight, families who rely on special education services at public schools are now sounding the alarm. Joining me now, parent advocate and mom of two, Jacqueline Castillo-Blaber. Jacqueline, your children rely on special education services in a school district where 24% of students have disabilities. How has the shutdown made things more challenging for you and your family?
It's created a lot of uncertainty. My son, he's disabled. He is autistic. He's non-speaking. He relies on Medicaid and the Affordable Care Act for affordable health care. And right now, I have to submit a new application in for him for his health insurance, and I don't know if that application will be processed. We need that for his occupational therapy, his speech therapy, for him to get a medical grade speech device. And he's in a window of learning right now where we can't afford a delay for that.
I'm so sorry for what you and your family and your son is going through, but what are some adjustments that your family has had to make in the meantime?
In the meantime, we're just working with the school team and everything, but there's a lot of families in our district. We're an economically disadvantaged city where there's a lot of working people who are underemployed and rely on SNAP and Medicaid and things like that. And right now, those benefits being not available, a lot of our parents, they have to exit the workforce to be caretakers when you have a disabled child. Our Salvation Army in Niagara Falls, they just did a news report that their shelves are bare. They've never been, this low. So there's a lot of, food insecurity that's happening. And so a lot of people are coming together, to make donations and everything, but it does create a strain.
It certainly does, and we've been seeing that across the country. Jacqueline, did you think this shutdown would last as long as it has?
Um, no, I mean, it is cold. I'm in Niagara Falls. I'm near Buffalo. We get a lot of cold and everything that happens. And, heat applications are, being delayed. Food insecurity, we're coming up to the holidays, and it's disappointing to know that um, whichever side that some of our most vulnerable at this time of the year are being put in jeopardy and everything. But absolutely, affordable health care is important to us. It's our lifeline to independence.
And with that said, Jacqueline, what is your message to lawmakers today?
Um, we really need to keep the short term and the long term outcomes that are happening and the consequences of negotiations and everything. And people really need to come to the table and work on things. But absolutely, without a doubt, healthcare is so important, especially in the disability community. We need our kids to be as close to independence as possible, so that they can be, functioning members of society. And I think they're vulnerable communities and they need our help.
Absolutely. Jacqueline Castillo-Blaber, thank you so much for joining us.
Thank you.